So you just got your document evaluation results. Now what? A lot of internationally trained pharmacists know the PEBC exams exist, but almost nobody walks you through the full picture. What order things happen in, how long each gap actually takes, and where the process can surprise you. In the next few minutes, I'm going to map out the entire PEBC pathway from start to finish so you can plan your life around it, not the other way around. Think of the PEBC pathway as a four-stage relay race. Document evaluation is the entry ticket. PEBC reviews your pharmacy credentials and decides whether you're eligible to proceed. Once you pass DE, you move into the evaluating examination. Clear that, and you unlock the two-part qualifying exam. First the written MCQ, then the clinical OSCE. Only after all of those does a provincial regulatory authority even look at your full file for licensure. Each stage feeds directly into the next. You can't skip ahead, and the clock on each stage only starts ticking after the previous one is done. Document evaluation is essentially PEBC asking, is this person's pharmacy training substantially equivalent to a Canadian pharmacy degree? You submit your credentials, transcripts, and supporting documents, and PEBC's assessors review them. The honest reality is that processing times are not instant. Many candidates wait several months, sometimes longer, depending on volume and whether PEBC needs additional documents from you. The key takeaway here is don't just submit and forget. Track your application status, respond to any requests quickly, and use that waiting time productively. Because the evaluating exam is your next challenge, and it's a significant one. The evaluating examination, or EE, is a knowledge-based exam designed to confirm that your clinical and pharmaceutical knowledge meets Canadian pharmacy standards. Under the current blueprint, it consists of 140 questions split into two 90-minute sections. It's worth knowing that the blueprint has evolved, health equity content has been added, and Biomedical Sciences is no longer its own separate section. That content is now woven into broader competency areas. The EE is offered 4 sessions per year, so if you need to retake it, you're not waiting forever. Study hard the first time, but know there is a path forward if things don't go as planned. Here's a mistake I see a lot of candidates make. They pass the E, exhale, and take a long mental break before thinking about QEI. Don't do that. The gap between getting your EE result and your QEI sitting can feel short once you factor in application processing, session scheduling, and your own preparation time. QEI is the written MCQ component of the qualifying exam, and while there's conceptual overlap with the EE, it's more scenario-based, more clinical, and it expects you to apply judgment, not just recall facts. Treat the post-EE window as a runway, not a rest stop. The qualifying exam Part 1 is the MCQ portion of the exam that assesses whether you're ready to practice pharmacy in Canada at an entry-to-practice level. The questions are scenario-driven. You'll be given patient cases, drug therapy problems, and practice situations that require you to reason through to the best answer. It's less about memorizing a drug list and more about demonstrating you can think like a practicing Canadian pharmacist. You must pass QE1 before you're eligible to register for QE2. There's no way to sit them simultaneously. So your performance here is a real gate. QE2 is the OSCE, the Objective Structured Clinical Examination, and it is a different beast entirely from anything that came before it. Instead of sitting at a computer answering questions, you move through a series of real-time stations where you interact with standardized patients, respond to counseling scenarios, and demonstrate hands-on clinical communication skills. It's held in person at designated locations across Canada, which means travel may be part of your planning. Candidates who've aced the written exams sometimes underestimate QE2 because you can't just think the right answer, you have to perform it. Practice out loud, role play with study partners. It makes a measurable difference. Let's be real about timelines. From the moment you submit your DE application to the moment you hold a provincial pharmacy license, many candidates are looking at 2 to 3 years, sometimes more. That's not meant to discourage you. It's meant to help you plan. Waiting times, application windows, preparation periods, and retake scenarios all compound. Some candidates move faster, some take longer. The most important thing is to stay in motion. Don't let administrative gaps become unplanned idle time. Every month, you're waiting for something is a month you can be studying, practicing, or getting Canadian work experience. Passing QE2 doesn't automatically make you a licensed pharmacist. It makes you PEBC certified. The final step is applying to the pharmacy regulatory authority in the province where you want to practice. And here's where things diverge by candidate. Some provinces require a structured internship period. Others require a jurisprudence exam covering provincial pharmacy law, and some require both. Quebec has its own distinct pathway through its own body. The bottom line is, look up your specific province's requirements early, not after QE2. Knowing what's coming lets you line up your internship supervisor, your jurisprudence prep, and your application documents in parallel, so you're not adding extra months of delay at the very last stage. Now you've got the full picture: document evaluation, EE, QEI, QE2, and provincial licensure. The pathway is long, but it is absolutely doable when you know what's coming. If you want to go deeper on any individual stage, we've put together detailed study guides and practice question banks on our Etsy shop. The link is in the description and pinned in the comments below, so it's easy to find. Got questions about your specific situation? Drop them in the comments. I read every single one. And if you want to catch every new video we put out, stage-by-stage breakdowns, study plans, and exam walkthroughs, hit subscribe so you're always the first to know. You've got this. If this helped, check out these other PEBCBuddy videos to keep your prep going.